Hi, I'm Chelsea Burrell. I'm the Community Wellness Outreach Coordinator for Harris Regional and Swain Community Hospitals. My job has a lot of different hats, but my main priority right now is the Community Health Needs Assessment, which is what I'm going to talk to you guys about. How that process works, who we partner with, and hopefully the end result from this big process that we define or acronym as CHNA. Our region is a little different from all the regions in North Carolina, and that reason being because we have WNC Healthy Impact or WNC Health Network, and they are a partnership between health departments and hospitals to help us collaborate and partner in the ultimate goal of making communities healthier. They help us with the whole process and gathering data, giving us templates for the actual document that's written. They also provide trainings on various different things. So I really want to give them a huge thank you, and I really want to stress the importance of what they do, because without them, I'm not really sure we would be as successful in what we're trying to accomplish as collaborators and as partners within the communities that we serve. So just to discuss the process, I'm going to read to you what WNC Healthy Impact gives us and what they provide verbatim. So they provide a comprehensive set of publicly available secondary data metrics with our county compared to the 16 county WNC region. So the secondary data is old quote-unquote data or expired data that we don't have as current, and then the primary data is the current data from 2018 that we're going to share with the public. Obviously we share the secondary data, but the secondary data is not quite as impactful as the primary data. They also provide sets of maps accessed from Community Commons and NC Center for Health Statistics. The maps are very important, and they're very helpful whenever we're looking at the definition or the definitive area that has heart disease in counties, or the definitive area that is impacted most by cancer. So these maps give us a very defined look at the population and which part of that county is being impacted most by certain circumstances. So again, very helpful in helping us target our population that we serve and our population area as a whole. They also provide a community health survey, which is done through landline, cell phone, and online based, so internet based, and that is a random sample of adults within the county. So we're getting a very wide margin to actually help define our full county, because we don't want to have one specific population answer the questions, because that doesn't give us a accurate or definitive answer as to what the health needs of our county are. We want to be inclusive, not exclusive, so we're trying to include everybody within the county and make sure we're getting a very whole look at what that entails and how we can better serve our people and our population. The next thing that they do is they provide an online key informant survey, and that survey was very specific and helped us identify different needs or wants that the community members were seeing with specific items such as chronic disease, mental health, environmental factors, what they saw as the top priority or top need within the county, which again is verbal and written feedback for us to give us a good look at what that means and where we go from that process, which again is very helpful. We can look at the numbers all day long, but we want to make sure that we're considering the community members' thoughts and their feelings and their opinions on what matters most to them. So that process was very impactful for us to figure out, okay, the numbers say this, but the people are saying this. Which route do we go? So that's the first step in the process, providing the data, which was released on August 17th, 2018. That data was provided in a workbook for all of us in the health departments and the hospitals, and we collaborated together. We worked within the community, had community action teams and community assessments. From those processes, we narrowed down to 2 or 3 priorities for the county, and those priorities are what we're going to work on for the next 3 years. Once we set those priorities, then we initiate an implementation action plan, which is currently where we are in the process, is making an action plan in junction with those priorities, making sure that we are setting action plans that are feasible and they are the most impactful that we can possibly do to reach the most people and move that health assessment needle Anybody who works in healthcare knows that moving that needle in healthcare is a slow process. And so we don't take any of this lightly, and we know that we're not going to make significant changes within these next 3 years, but we're hopeful in making a small dent and making the most impact that we can in the communities that we serve. So right now, as a hospital system, we are doing the full CHNA report on our end and working on action plans that we can better serve our community with the services that we provide, and looking at how we impacted those priorities from 2015 to 2018 and what we can continue to work on and continue to add with the partnerships that we have within our communities. So that is the CHNA process, the Community Health Needs Assessment process in Western North Carolina and for us. And hopefully we will have all of that accomplished. The plan, not the actual results, but the plan will be accomplished soon with a written document, and it's already available to you from the health departments, but the hospitals will be available to you soon, hopefully by the summertime. So if you have any questions about that, please reach out and let me know. My email is my name, Chelsea.Burrell, Burrell, @westcare.org. And my phone number is 828-586-7391. So if you ever have any questions or comments, please let me know, and I'm happy to take your comments or your suggestions or even questions. Thank you so much for your time.